this one's by way of an apology to one Sally Dixon, who posted an advert for these things, elasticated arch pads, and asked the perfectly reasonable question, how are these going to work for plantar fasciitis? Surely they're too far forward. Dave Follen replied nope, and I replied mostly nope, which was true but is also unhelpful. So this is the slightly fuller response. Obviously they're not going to do all of the things it says in the advert. The idea that they align anything or that you put them on and suddenly you walk pain-free is bullshit. However, there are some benefits to these things. I actually quite like them for certain things. As far as plantar fasciitis is concerned, first of all, assuming we are talking about plantar fasciitis, because not all heel pain is plantar fasciitis, it will partly depend on whether we are dealing with an insertional fasciopathy, an enthesopathy, which would be right back there, or a slightly more distal fasciopathy, which would be sort of more under that area. Sometimes it's right there at the insertion, sometimes it's a little bit further down. The pad would be in the wrong place to cover the back of the heel, but you can reasonably compress the sort of middle to proximal bit of the plantar fascia. And compression is one of those things that, whilst we're not entirely clear on why it helps, it really, really does seem to. Patients do like, when you have an injury, to have it compressed. You've got a couple of other elements there as well. You've got elements of compression, you've got elements of keeping a small degree of tension on the plantar fascia, which could conceivably help. And you've got elements of the pain gate theory, which is that if you stimulate superficially, it can block pain sensations from deeper tissue. Now, none of these mean that it is a good treatment for plantar fasciitis. There's no controlled trials or anything like this on this that would suggest it should be a first-line treatment. But I do think it's probably a little unhelpful just to say no, it doesn't work, because there are some people who will have some symptomatic relief with this sort of thing. One thing I do find it very useful for, coincidentally, is mid-tarsal arthritis. When you've got arthritic pain across the midfoot there, having a compression and a cushion on the side of it like that actually quite often relieves symptoms. And again, there's no magic solutions, but yeah, they can be helpful. So to answer the question, yes, it is in the wrong place for plantar fasciitis. No, it is not a first-line treatment for plantar fasciitis, but if it's slightly more distal in the fascia, and what you are looking for is an immediate symptom relief, then yeah, an elastic strap might give some symptomatic relief. I don't know how much they were selling them from on that advert, but I get these for about £1 from eBay or China. So for £1, it's almost worth just chucking it on there as a garnish. For the one patient in 20 who really, really likes them and find they help, might be worth a try.